Hello, aspiring nurses. This is Nurse Ed Scholar here, um, going over another assessment. And today we're going to dive into the intricacies of the ear assessment. So join me in understanding the aspects of inspecting, palpating, and testing hearing. So let's get started. When we're gathering subjective data, we are going to inquire about hearing difficulties, ear aches, dizziness, ringing in the ears, draining from the ears, exposure to environmental noises, like if the patient works in a factory, use of a hearing aid, history of ear problems, or history of ear infections. And all of this kind of sets up the foundation for your ear assessment. And when we move on to the objective data, we're going to inspect and palpate the external ear. We're looking for size, shape, symmetry, skin color, pain. And when we're looking at the external auditory meatus, we're examining for swelling, redness, discharge, foreign bodies, or even cerumen. And another name for cerumen is earwax. Now, before diving deeper, let's understand some auditory assessment basics. We explore air and bone conduction and the categories of hearing loss, and those are conductive, sensorineural, and mixed. And these fundamentals kind of provide a backdrop for our assessments. But before moving on, let me define some terms. So, well, when you're looking at air conduction takes 2 to 3 times longer than bone conduction. If there is any kind of physical obstruction to the transmission of sound waves, this causes a conductive hearing loss. Now, if there is a defect in the cochlea, this will cause sensorineural hearing loss. And then mixed is a combination of conductive and sensorineural hearing loss. And that results from problems in both the middle ear and outer ear or the middle ear. Now, when we're looking at our arsenal for hearing tests, you have the whisper test. Now, that'll determine whether a hearing loss has occurred. Then there's the watch test, which uses a watch, a ticking watch, and it tests for high frequency sounds. And then the tuning fork test measures hearing based on air and bone conduction. So each aid in determining hearing loss based on various aspects. So in a thorough understanding of these tests will enhance our ability to assess our patient's auditory function. Now, when we're moving on to the otoscopic examination, we are checking for foreign bodies, okay? And so we're going to instruct, the client a certain, their position, and we're going to make sure that they remain safe during the examination. Because we're going to make sure that we don't insert the speculum of the otoscope without kind of observing to make sure that there's no foreign bodies in the canal. Now, we're going to look at the external canal, and we're looking for it being intact. We're going to look at the tympanic membrane carefully. Like I said, when we're going in and doing our assessment, We're checking for any foreign bodies. We're looking at the external canal, looking at the tympanic membranes. And first thing that we learn as nurses is what's a normal finding. So when we're looking in the ear, we're making sure that the membranes are intact, that there's transparency, and then there is a presence of a cone of light reflex. Okay. So it's always important to know the normals. So as you're a new nurse, you want to make sure you look in everyone's ear that is healthy. So when you do inspect an ear that there's an abnormality, you may not know what it is, but you'll know that there is something wrong. Okay. And I want to repeat this again. Never insert an otoscope blindly because you don't know if there are any foreign bodies in there, and that can push it in further in the ear canal. Okay. Now, when we educate our clients, we want to instruct them to notify their primary care provider for any kind of hearing alterations, any kind of ear pain, ringing in the ears, discharge from the ears, or any kind of swelling. We're going to teach our patients the proper techniques of cleaning the ears. We're not supposed to insert anything sharp in the ear. And technically, we're not even supposed to be putting Q-tips in the ear. Okay. But what we're trying to do is help ensure our patients' ear health. Okay. And that kind of sums it up. That was just a brief overview of an ear assessment. Understand that your knowledge and attention to detail when it comes to performing an ear assessment is vital. Knowing the different hearing tests, will position you to be a successful nurse. Okay. So until next time, best of luck on your nursing journey.